Hello, this is your Louisiana chiropractor, Dr. Eric Prather, coming to you from Lafayette, Louisiana, Prather Chiropractic Services. Today, Miss Gail returns for her weekly decompression and adjustment and ring dinger. And you got any complaints today, Miss Gail? Any chief complaints?
I don't.
No? Any questions for me about health, nutrition, about things going on?
Yeah, I would like to start making my own bone broth.
Bone broth.
And I've been to 3 stores and they don't have it.
No bones? You don't have any butchers selling you any bones?
No, the first one I went to, they don't get them that way. They get it all together and they sell it.
The meat's already been
It's
processed
bones
quite
already in the
extensively.
meat.
Okay.
And so I did buy some shank and I put that in the slow cooker for 12 hours.
12 hours.
Mm-hmm.
A beef shank.
That's what it took, and it was good, but I'm not gonna say it's bone broth.
Yeah.
I would prefer just to have the bone with the marrow in the middle.
marrow in the middle.
That's all you need.
Now, that's something we've recommended to patients in the past. They've asked me, hey, what can I do to help with inflammation in my joints? What can I do to help rejuvenate connective tissue in cartilage in the body? Bone broth is one of the recommendations. If you can make it at home, that's even better. If you can buy it in a store, that's one thing. But when you take a bone and you're able to boil it and cook out all of the collagen and bone marrow and minerals and you name it, and consume that on a regular basis, we know that collagen, as it gets into your system, can really help with inflammation in the joints, help with degenerative arthritis. So I encourage my patients all the time, versus relying on an anti-inflammatory medication, an NSAID or some sort of steroid that can potentially soften and weaken your bones and damage your stomach. If they can do things more naturally, give your body the raw ingredients it needs to build good, healthy bone and strong connective tissue, bone broth is a way to achieve that. So we discussed that with Ms. Gail in the past, and I advised her if she could get with the local butcher to secure a beef shank, like a thigh bone, something that has a lot of marrow in it, a lot of minerals, that really does well for bone broth. But what you're telling me is you're having trouble securing.
Yeah, but like I said, I've only been to two or 3 stores. There's a store in River Range that I'm gonna go to.
Okay.
I'm gonna see what they say and what they have. And
what about New News? Did you try the New News grocery?
where's that?
There's one in Scott.
There's one in Youngsville.
There's one in Youngsville.
Oh, is that one in Lafayette?
I think you'll probably have better success
New News.
with small local. In any meat market, there's a Chops in Broussard that may be a Chops meat market.
Bios too.
Yeah, where's that?
Bios, I think that's what it's called. That's in Broussard as well.
There's anybody who processes meat.
Well, that's in Maurice. I can go there. Yeah.
But I think it'll require, anywhere you are, try to develop a relationship with your local butcher. Put them on notice. Should they receive any sort of big bones in their shipment of meat, to hold them for you, and
now
you'll be able to pick those up.
Albertsons they get it, but it's full of I don't know. There's all kinds of stuff attached to it.
Really? Like a lot of meat on the shank you're talking about?
Not a lot of meat, but there is meat and cartilage. Is it okay to put cartilage?
Oh yeah, absolutely. You want that? Yes, ma'am. Yes, ma'am. And you flavor it when you're making the bone broth. You flavor it to your likeness. You add the celery, add the carrots, the onions.
Carrots, onions.
You can put ginger in there.
Garlic, ginger. I forgot the ginger this time.
Okay, that'll give it a bit of an Asian cuisine
And
lean.
cider vinegar too.
There you go.
So those bones will release the
Right.
nutrients.
Yeah, that'll help break down that collagen
Break
even
it
more.
down.
Put it in the solution. Yeah, the longer you can cook it, the more you can cook down the proteins and get that dissolved into solution. That's the more you're going to take in when you drink it. So
I had to cook it 12 hours because the meat was just not tender.
right.
So I just kept cooking it.
Did you have it on a rolling boil or just a simmer?
I had it in the slow cooker.
Oh, slow cooker. That's right.
On low.
On low. All right. Well, you can try it on high too, or on low, or on the stove.
Yeah, it came out good. It's just that I wanted bone broth. I didn't want a bunch of meat.
Right, right. So you strained it out into some containers?
I ate it like it was.
You ate like it was, huh? Okay.
With no rice.
Yeah, cut down the
It was
starches,
good.
right?
It was good.
Well, you got everything you need. You got everything you need in that.
It's
And
just that, you know, it wasn't bone broth per se. It
well,
was-
Cajun food down here, almost everything is served over rice, and
Oh, I know, but
you can't do that all the time, huh? Those big heavy gravies,
no.
putting that over rice, it
No,
spikes your blood sugar
and
too
you
much.
feel a lot better too. if
Right.
you
Keep it-
eliminate- yeah.
Keep your nutrition, proteins, healthy fats, fruits and veggies. Mostly veggies, fruits
Simple.
occasionally.
Simple,
So-
yeah.
Well, yeah, you've always followed a very, very healthy diet and been very conscientious about nutrition and understood its role in staying healthy and staying off of medications.
Oh,
Do you
yeah.
take any medications at all?
Thyroid,
Thyroid.
all
Yeah.
my thyroid, 30 milligrams.
Okay, so just keep the iodine up and
That's all I do, and iodine,
Mhm.
my Iodamir.
Rhinomere.
Yeah.
Right, well, that's whole,
And
whole,
adrenal,
right,
from SP.
protein, right. The standard process, whole food supplementation.
yeah.
Well, that's great. That's a testament to your attention to nutrition, how it's kept you off of medications. Now, you've recently had some blood work. I remember you showed me, you brought in your cholesterol panel.
I did.
And there's a ton of misinformation about high cholesterol, by the way, of its role in heart disease and whatnot. People, for whatever reason, have become very fearful of a total cholesterol count being
It's
above
also
200.
inherited.
Yeah, it's inherited.
In my
Certainly
case,
looked
it
at
is, 'cause my
profile.
daddy had that.
But yours is fine though. When we looked at the breakdown, and that's what you have to look at. You have to look at the breakdown of the cholesterol, right? So you have a total number, then you have your LDLs, your VLDLs, and your HDLs. That ratio between HDL and LDL needs to be 2-to-1. So for every 2 LDLs I need 1 HDL, and that's a greater indicator of your cardiovascular risk than your total cholesterol number. So if my LDL is 120, all right, any doctor will tell you LDLs over 100 is a bad thing. So if my LDLs are 120, and let's say my HDLs are 60 or higher, you actually have a lower risk of heart disease than a person with an LDL of 100 or 90, and their HDLs are down in the 20s or the 30s. So their total LDL count is below 100, but they're at a greater risk for atherosclerosis than a person with the 120 and the 60 because of that ratio. HDL's job is to help escort LDLs from the blood back to the liver for processing. That's the job. So if I have an LDL count of 80, which is below 100, seemingly low risk, and your HDLs are only 20, you have a greater than 2-to-1 ratio, and that's bad. So how do we increase our HDL count?
That's what saves me, it's high.
That's right, yours is extremely high. Yours is the highest I've ever seen of anybody.
Well, I do a lot of good olive oil.
Olive oil, fish oil, avocado, your omega-3 fats.
Yeah, I do avocado,
Right.
I do omega-3s.
We get way too many omega-6 fats in the diet and not nearly enough omega-3s. And omega-3s, incorporating that into the diet with, walnuts,
Walnuts, I do
almonds, your healthy tree nuts, if you're okay to eat that. If you have a tree nut allergy, make sure you don't do that. But there's other sources, the olive oil, like you said, the fish oil, krill oil, very, very good at raising our HDL count. That's how you reduce that LDL ratio and reduce your risk. So just a ton of misinformation. Oftentimes patients will get on cholesterol medicine and it lowers their total, but their ratios are still way off. Their HDLs are still way low. So your risk is improved, but not as great as it could be. So that's good information. Yeah, your HDL count was like 90. That was amazing. that's very high. 92.
See, my cholesterol's always been high.
Right, but it's high
Always.
with healthy cholesterol. And I'm sure you pretty much have no other signs of cardiovascular disease whatsoever.
No, I go to Dr. Ali. And
Okay.
he doesn't-
Excellent.
Yeah.
Dr. David Ali, one of the best vascular surgeons that I've ever seen.
Yeah,
Yeah,
they didn't, everything was,
everything checked out.
they did the legs this time, and next time they'll do something else.
Circulation was good.
That,
Yeah.
And that's what they go by.
That's what they go by.
That's that starting point.
Right. when a person has real high cholesterol, there's a thought that the blood can become somewhat thicker. So obviously that'll reduce circulation into those real tiny microcapillaries.
I wanted to go, of course it was time to go, but I wanted to go because after that push down I took, that accident in August, I was afraid it may, because it left me with this spot this blue spot right here, which
bruising
I did not have before.
And some broken blood vessels. That was
I
quite
did
a tumble.
not have before.
Right.
But he said it didn't. It's fine. It's just like it was last time. So I was glad for that.
Very good. Okay, well, any other questions for me?
I don't think so.
That's a lot. No, that's a lot. A lot of helpful info.
Yeah, the bone broth. I'll have to just start working on that.
Yeah, securing those bones by any means. I wonder if you can order that online.
Oh, you can.
You can order the bone itself?
The bone, yeah, you can order anything on
Yeah, we guess so.
It's pretty expensive.
It is.
And also when you buy it ready-made in the frozen section, it's very expensive. So it's better to make your own. Now the powders are not too bad. I'm on a powder now. It's a multi.
It's like a bone meal powder.
I guess so.
Yeah, I mean, whole ground up bone.
Yeah.
The standard process has a supplement called Calcifood, which is just that very thing. It's ground bone meal, and it's put into a chewable wafer.
Okay. Well, that's the calcium though.
No, but it's the closest thing to eating the whole bone. You're
Oh,
basically getting everything that you would get from the bone in a chewable
This
wafer.
is collagen type 1 through 5.
Okay, very good.
By Dr. Axe.
Probably has some good products. I've not researched a lot of his
That's all I
supplements,
see on the
but
shelf, so that's what I'm taking.
Give it a try.
I don't know if I'll buy it again, but
well, you definitely have strong bones. Definitely have
I
strong
do.
bones.
That's one of the things that saved me.
That's right.
When I went down.
Miss Gail, you had a fall. How long ago was it?
August 23rd.
August
Late
23rd.
20.
Had a dog running wild, run and cut out your legs from underneath you.
It just pushed me down right
Pushed you down,
here. Just pushed me down.
and you fell and
On this side.
fractured your pelvis
In 3 places.
in 3 places. So that's not that long ago, and you've healed up.
But
You've resumed your chiropractic care.
if I wouldn't have had such, like you say, good bones, I'd broke my hip too.
Right.
And no telling what else.
Yeah, that could result in hip replacement surgery, all kinds of problems.
Yeah, right now I'm not going anywhere, but we'll see in the future.
Okay. All right, wonderful. Well, let's get into your adjustment. You ready?
Mm-hmm.
All right. Okay. Let those legs relax. Okay, we're gonna elevate this towel. Shoulders doing okay?
Pretty good. I iced it twice yesterday. And it's a very necessary.
Regimen, yeah, that's a good
Very necessary,
intervention.
because it was hurting. So I did it and the pain went away right then.
Okay, knock that
So
inflammation
I
out.
did it again last night. I will start doing it twice a day.
Okay. All right. All right, make sure we're in the fleshy part of the side here, Ms. Gail. We okay there?
Mm-hmm.
Not too tight? All right. Back teeth touching. Breathing through the nose. Give me a good exhale there. There you go.
You didn't give me a chance to do it.
How far down did you feel
Too
that?
quick.
We've broken up a lot of adhesions.
Yeah, I
This is
know.
like your 4th or 5th decompression, and we're clearing out a lot of that scar tissue.
I feel it clearing out.
That's amazing. And that's the beautiful thing about this decompression procedure, is I'm really noticing how it helps a patient's adjustments last longer, getting more and more stay put value out of that adjustment. Okay. Spin you around. All right, let's move it on over. Okay.
start with that one.
Okay. That's this piece here. Let's check your leg length. A little short on that right side. It gets longer as we flex. Okay. Just to be expected. That's the,
Fitting with the shoes, huh?
nah, that's a hip you had fallen on, so let's get into it here. Good release. Good release. Okay. Pretty good. Pretty even there. All right, working those neck. All right, Miss Gail, let's roll it on over. Okay, then adjust that head back over the shoulders. Okay, arms outstretched for me. Okay, hands on the tummy. Here we go. Good release. Good release. There we go. Get all those mechanoreceptors firing today.
Yep.
Good. All right, there we go. Spine's feeling better and better each week. Better and better.
I feel it. I can tell, just going through the day that it's a lot better.
Yeah, you've been with me a long time, and the fact that we're able to adjust in more planes of movement has, I can, like I said, I can feel it
I'm
in your
walking
joints.
better too. I'm going a little longer now than I was, when I first started.
We covered some good information today. You got any more
Thanks.
questions for me?
Not today.
All right.
I have lots of subjects, but.
We'll save that for another visit.
Okay.
All right, this is your Louisiana chiropractor, Dr. Eric Prather. We'll see you soon.